Welcome back, everybody, to your weekly rounds. I am Dr. Corey King from AskDrKing.com. We are located in Lafayette, Colorado. I specialize in working with autoimmune patients, thyroid patients, and we see a lot of Epstein-Barr virus and a lot of Lyme disease. So in today's weekly rounds, this is going to be a case of a misdiagnosis. This is a 28-year-old female. She is a mother. Her and her husband have been going to her Kaiser doctor, telling the doctors how she's feeling. The doctors at one point actually told her that it was all emotional and she needed to check herself into a facility to deal with what she was going through. So we're not going to talk bad about the Kaiser doctors today, but we are going to show you the difference between going to a Kaiser doctor that is not, I'm not going to say not educated enough because they did become a doctor in the first place, but they are missing the boat. So she reached out to me. She was sharing her health history with me. She sent me some of her lab test results. And what was happening was one of her chief complaints was joint pains. And when she went to the Kaiser doctor, the doctors automatically thought about rheumatoid arthritis. So they run her rheumatoid factor. Here's her rheumatoid factor. And it is above the normal range. So at 23, the doctors automatically jump on the rheumatoid factor bandwagon. Now, I have seen this happen in a couple patients. I still can't fully explain the scientific reasoning behind it, but I'm seeing a pattern. So they thought she had rheumatoid arthritis. They wanted to go down the traditional medical model, the medications that they give for RA patients, but she reached out to me, and when she was sharing her health history, one thing that stuck out to me was the fact that her joint pains moved around. They weren't always the same. That was a red flag for me. And I said, you know what? That sounds to me like Lyme disease. And she's in Southern California. I do see a lot of patients with Lyme in Southern California. It's not just the East Coast patients that are diagnosed with Lyme disease. So I said, I'm going to recommend a Lyme disease test along with some other testing. Here are some blood markers. Have your Kaiser doctor run them. Hopefully they'll run them. So the Kaiser doctor wanted to then run a Lyme panel. Well, their Lyme panel, as you can see here, was only checking for Borrelia. It wasn't checking the IgG or the IgM antibodies. So it came up negative. I warned the patient about this beforehand. I said, their testing isn't going to be that great. And if it comes up negative, it doesn't mean anything in my eyes. If it comes up positive, it's like, whoa, they actually found it. But if it comes up negative, don't put a lot of stock into that test result. When we ran her Lyme testing, now we ran that through Immunosciences lab, here are the results. Here's the first page. It's looking at both IgM, which is a more recent infection, and IgG, which is more chronic infection. So if you look at her Borrelia IgM marker, it's positive at 0.9. The cutoff point is 0.81. Then we see all these other co-infections at 1.1, 1.0, 1.1, 0.9, 1, 1.2, 0.9. We get down to Babesia, and her Babesia IgG, which is the more chronic marker, is at 0.8. The cutoff point is 0.81. To me, that's too close to call. So this tells me that this infection has been there at least a year. We go to this next page. We see two more positives. Bartonella is positive, Ehrlichia is positive. So this to me is full-blown Lyme disease. This is what boggles my mind. She went back to Kaiser, saw an infectious disease doctor. That infectious disease doctor looked at these test results and goes, no, you don't have Lyme. I prepared the patient for this. So I said, when you go to that infectious disease doctor, they may tell you that you don't have Lyme. You're going to want to ask them, doctor, do you know what IgM and IgG markers mean? That is me being a little smart butt, because sometimes you have to turn around and let these doctors know that you know more than they think you know. Because that doctor should know exactly what these test results mean. Imagine how many patients he is told you do not have X, Y, and Z, but they did. This is what boggles my mind. This is where the traditional medical model is going to fail patients. This is why Lyme disease patients have been misdiagnosed for 5, 10, 15, 20 years, which means they've been mistreated, which means they've lost that many years of their life because the doctors weren't educated enough to understand how to interpret a test or to actually run a really good test. Her rheumatoid factor came up positive. I have seen this a couple times with Lyme patients. I just think it's a false positive for RA because we then ran what is called a Cyrex panel on this patient. Cyrex was developed by the same immunologist that developed Immunosciences Lab, the same Lyme test that we just showed you. So we look at her Cyrex panel. Her Cyrex panel is coming up completely normal for these 3 markers. What these markers are telling us is her body actually attacking her joints like it would in a rheumatoid arthritis case? 0 markers came out positive. This is not RA. This is not rheumatoid arthritis. This is Lyme disease mimicking another health condition, which that's why a lot of people will call Lyme disease a great mimicker, because it mimics, or it can artificially make some of these other markers go up, and then the doctors go down that rabbit hole of chasing that disease when it's another condition altogether. Now, I do want to show you some of our other markers. Here's her organic acids test. If you've been watching these videos, you do know that I run this test on every patient, and a lot of patients come up high for an overgrowth of candida. She actually had a few markers that were positive here. When we first started working with her, the first week, the goal was to go after the candida before we started going after the Lyme. I changed her food, changed the way that she ate, and she crashed. She was having major hypoglycemic symptoms. We added some foods back in. That second week of the Lyme protocol, then, she started feeling a lot better. Her hands and her feet pain almost went down to 0. The knee pain, which is typically between a 7 to a 9 on that 0 to 10 pain scale, she told me went down to a 2 to a 4 in less than 2 weeks. Amazing results so far. We saw that there's some candida overgrowth, and the other thing is we started looking at her genetics. We look at genetic testing on every single new patient. Why? Because I want to get to the root cause of why the body wasn't able to fight off an infection such as Lyme disease. Not everybody that gets bit by a tick develops Lyme disease. So for her, she had a lot of these methylation mutations, both MTHFR 677 and 1298, which is going to impact how well her immune system can see and kill bad guys. It's also going to impact how well her body can detoxify. So we want to get those mutations supported with really good folate, and there's different types of folic acid. It's not always take folic acid, so don't get caught in that rabbit hole as well. That happened to a patient yesterday from what the traditional doctor was telling her about her son, who happens to be a professional athlete with celiac disease. So she has multiple genetic mutations impacting methylation. She also has a few mutations impacting glutathione production, like GSTP1, which tells us her body's going to have a hard time binding some of these toxins and getting inflammation down, and glutathione plays a big role in liver detoxification as well. And then she has multiple inflammatory markers. So what does this mean? All of these markers are telling us that anything that creates inflammation, whether it's spirochetes that are attacking the body or it's a candida infection, anything that's going to create inflammation, her body's going to have a really difficult time controlling, calming down that inflammation. So for her, lots of pain. And then we saw some external inflammatory markers. One of the big ones here, her body doesn't make good bacteria very well, so you can bet she's going to be on a good probiotic. She does have to stay away from gluten. She has the HLDQA2. She has 1 mutation of that, and she needs a little bit of K to help absorb her vitamin D. So these are some of the other markers that we ran, but big picture I want you to understand is if you go to your traditional doctor and you're complaining of symptoms and they're running basic tests and they just want to jump on medication and deep down you don't feel that's the right way, dig deeper. Find a doctor that's going to run some of these other types of tests to get more answers. The more answers you have, the more complete picture you can develop, and the better the game plan is going to be, which means you're going to heal faster. So we look forward to seeing you on our next weekly rounds. Have a fantastic day.